Hello, everybody. Hope everyone's doing well. Today we are doing a topic that I hear about all the time. It's called Molluscum Contagiosum. I see it all the time. My friends ask me all the time. My patients ask me all the time. So that is what we are going to talk about today. So what is molluscum and what does it look like? Here's a lovely picture. Bear with me, and I'm not super techie. So I'm holding up my iPad that shows you a picture as best as I can. It's these little flesh-colored, kind of dome-shaped spots that you see on kids, mainly on kids. You can get them on adults. The only known host for these is humans, so you're not going to see them on animals or anything. And it's a chronic, kind of localized infection that takes place, but it is a virus. So it is spread via skin contact. So if you have them here and you touch here and touch here, or kids touch each other there, it's going to spread. It can occur anywhere on the body. You do not see it on the hands, the palms of your hands and the soles of your feet, though. That area is spread. It is spared. You can also get spread from like sharing towels and sponges and things like that. The incubation time period, so the time in which you touch somebody to when you could end up getting the infection, is about 2 to 6 weeks. So be on the lookout after that time period if there's an exposure. Not everybody gets it though, so I definitely see more kids more prone to it than others. Sometimes they are itchy and sometimes they're not. Sometimes they're just there and they don't bother anybody, except most people don't like the way they look. So that is why I get the question a lot. The biggest thing, do they go away and how do we make them go away? So with healthy immune systems in individuals, they do self-resolve. So it can take a long time though. 2 months, 6 months, even up to 12 months for these spots to go away. And they can spread. So obviously, naturally, it drives people crazy. And they're like, what are these spots? We need to get rid of them. I don't like the way they look. And it's hard for people to understand, just leave them alone. And they often do go away. However, there are times when we will treat them. Now, treatment is... that is debatable because it's not well studied. There is just not a lot of good evidence saying that this treatment definitely works. So I can go through some options with you. I will tell you the times in which I treat is where we feel like they're spreading like crazy. If we have them on the face and they can be really bothersome for people there. If kids are itching and scratching them a lot, that's also another time when I will try to do something to get rid of them. So our options are, number one, is cryotherapy, which is basically when you freeze them. I will tell you that is not something that I typically recommend in kids because it's painful and it hurts. So that is not one that I personally, as a pediatrician, recommend doing in my office. Now, other doctors might recommend it, and that's totally fine. Dermatologists will do it. It's just not something that I personally choose to do. Another one is cutting them off. Some people do that. Again, I don't think most kids tolerate that very well or take to that very well. My favorite option is something we call Beetlejuice, which is a topical medicine that we put on that really irritates it, turns it red, and causes it to blister. And that's the goal, is it blisters and kind of just goes away. Typically not a painful experience. So that is probably my top choice. Other things I have tried that I have had success with in the past, and again, this is just on my personal clinical trials, not so much well studied because the studies just aren't very supportive overall. So other things I've done, Retin-A, topical for some that have been on the facial area, like maybe around that spot when I'm trying to get rid of them. And also salicylic acid I have tried a couple times and had success. So all of these options are ones you should definitely talk with your doctor about. You should never go and just try these on your own. Definitely have a conversation with your doctor so they can look at the lesions and confirm, like, yes, these are molluscum or not. So I hope this video was helpful. I had a lot of people asking for something like this, so we'll probably try and do some more rashes and common things as well. Bye, guys.